Today I'm looking at some of the most unique medical conditions and surgeries caught on camera. Some of these I've never even heard of, they're so rare. Also, huge thanks to ShipStation for sponsoring this video. Let's get started.
Disa is a small agricultural town in northwest India. 13-year-old Shreya lives here with her extended family. But 18 months ago, Shreya found herself at the center of a medical mystery.
One evening, she sat here and complained her ear was hurting. When I checked, I found an ant.
When I look inside my patient's ears using an otoscope, I find unique things. A lot of times it's pieces of cotton from using Q-tips, which I tell them not to put deep inside their ears. But there have been insect parts or even insects that I've seen inside people's ears, so that's not totally unusual.
Shreya had been sleeping on the floor, and in the summer, ants are common.
After that, more and more ants were appearing. It was painful and itchy.
Not only is it painful and itchy, but you're gonna hear the ants moving around in there. It can drive a person mad.
MRI and CT scans were taken as Dr. Talsania searched for somewhere within the soft tissue or bone around Shreya's ear where an ant may have laid eggs.
Like in the eustachian tube?
But incredibly, the scans showed nothing unusual. Then, after nearly 8 months, just as suddenly as they first appeared, the ants vanished. In that time, about 1,000 ants had been removed from Shreya's ear.
I don't know why they aren't coming anymore. When I read all the medical science books, no one knows why and how the ants entered her ears in the first place.
There must be some kind of hygiene issue where the ants were able to enter the ear and they sat in some sort of crevice behind a part of the ear and were able to lay some eggs. And when those eggs were hatching, the ants were coming out.
The De Silva family never misses an opportunity to get together. They're excellent musicians and dancers, but it's something in their genes that truly sets them apart.
Oh, polydactyly.
14 members of the De Silva family have 6 fingers on each hand and 6 toes on each foot.
They must have some kind of gene that encodes for this.
Anna Carolina, she has 6. Zhao, my son, has 6.
Wow.
Today, the family's celebrating the arrival of a baby boy. His father, Alessandro, has 6 fingers.
It's gotta be some kind of dominant gene because it's being passed on to, it seems like, every member of the family. So it's some kind of autosomal dominant gene.
So, like his older brother, he had a 50% chance of inheriting the 6-finger gene.
Let's count them. 1, 2, 3, 4, 5, and 6.
My brother is going to have 6 fingers.
Gotta love the ultrasound probe.
The De Silva family's hands are all fine and functional, and they find 6 fingers can be an asset.
The coolest thing about having 6 fingers is being able to hold a lot of things at once.
Yeah, I can't imagine that being a major detriment in any way, really. Maybe for things designed for people with 5 fingers, like gloves. Like it might be complicated to find a set of gloves, so you might have to use mittens. Let's take a minute and talk about ShipStation, the leading web-based order management and shipping software. It's designed to make retailers' lives easier by making processing, fulfilling, and shipping e-commerce orders more efficient. It's still early in the year, which means you have time to keep your small business competitive by giving yourself access to the best tools in the industry. I would know, as I sell my own merch, and believe me, one thing that can make your shipping process so much easier is ShipStation. Thanks to them, you can focus on growing your business from day one, as they eliminate the headaches that come with printing labels or handling orders across multiple platforms like Amazon, Etsy, eBay, Shopify, and more. One of my favorite parts about them is how good their rates are. And get this, they just got even better. Because now with ShipStation, you can get up to 84% off USPS and UPS rates. And with enterprise solutions that make warehouse optimization easy, ShipStation scales when you do. Over 130,000 companies have grown their e-commerce business thanks to them. And 98% of companies that use them for 1 year become customers for life. Keep growing your business all year long with ShipStation. Go to shipstation.com/Dr. Mike today and sign up for a free 60-day trial. All right, let's get back to these conditions.
17-year-old Workatu lives in Addis Ababa, Ethiopia. She looks like a typical teenager, but has spent much of her life hiding an unusually rare physical condition. Workatu was born with an extra set of arms and legs. limbs from a parasitic twin that died in her mother's womb.
Okay, so when they say parasitic twin, the reason they say it that way, it sounds like there's some kind of illness going on. But what's in reality has happened is you had an underdeveloped or non-fully developed twin happen inside your body or on the outside of your body that didn't have any organs and essentially is surviving off of the energy and lifeblood off the single body.
Workatu grew up thinking her body was normal, although her parents insisted she cover herself with long dresses. Workatu was 11 years old when she found out that her body was different during a school sports class.
That's got to be difficult if you're the only one in your class experiencing something like this. You're going to feel like an outlier, and you're going to need support from your friends and family, and maybe even medical professionals.
The Cure Hospital in Addis Ababa is Ethiopia's leading children's hospital. It specializes in treating common deformities like cleft palate. But doctors there had never taken on a case as complex as Workatu's.
I mean, in many cases, this is a surgical procedure that can be done and would probably help the individual significantly, if not for anything, the musculoskeletal support. Remember, carrying excess weight of limbs on your body is not comfortable for the biomechanics of walking, let alone standing.
After 3 weeks of tests, the doctors decided they could operate. The limbs of the parasitic twin would be amputated. Surgery of this kind had never been attempted in Ethiopia.
The only option that you have for treating this problem is surgery.
Yeah, it's surgery with an amputation and then some kind of embolization of the arteries to prevent the person from bleeding out.
So we have to do as many imaging studies as we can to be able to document in our minds exactly what the anatomy is as close as possible.
That's why a lot of times when patients request a CT scan and MRI, we have to agree that the reason we're doing these scans is for the purpose of getting surgery. Because in many instances, getting an MRI to get a diagnosis doesn't help you in any way other than making a diagnosis for the surgeon.
We started first with the rudimentary arms because we thought that would be easier. And actually that came off as easy as it possibly could have. Then we moved down to the lower part, which is where the pelvis was, where we were going to remove her legs. And this was a little bit more challenging.
I can imagine this being challenging because you got to navigate the host or patient's organs and circulatory system. Remember, her body has been feeding these limbs blood rich in oxygen, so that there's these extra arteries that need to be severed, but you also need to make sure you're not severing arteries that could be also contributing to her health. And sometimes with patients that have what they're referring to as a parasitic twin, they can have one of these like fully inside their body, and sometimes we can't even know if this is what's known as a teratoma, which is a type of tumor that has all different types of cell lines in it, hair, fingernails, bones, etc., or is it truly a parasitic twin?
I used to work in a plastic packaging factory, operating an extruder machine.
An extruder machine grinds and melts plastic materials to create tubing, plastic sheets, and films.
I was assisting the machine operator. My hand was dragged into the cylinder. I held my arm and screamed. I could feel the tip of my fingers inside it. It was an agonizing moment.
The night shift called me and explained that they had a case where they were likely to amputate.
So in many instances, when you have a hand injury, especially a crush injury, unless you have a super subspecialized hand surgeon, you will just go forward with the amputation. Even in our ERs here in the Northeast, if you have a patient with a bone injury of the hand, you generally don't call the general orthopedist, you call a hand surgeon.
Dr. Brandau planned to surgically insert Carlos's left hand inside his abdomen to allow his body to regrow torn flesh and nerve tendons.
We made an incision on the side of his abdomen. This created a space in between the skin and muscle to tuck his hand, where it would connect with live tissues, creating a neovascularization.
We have seen this happen with burn patients before. I haven't seen this happen with a trauma situation like this.
For 6 weeks, Carlos endured the physical and mental anguish of having the affixed hand.
I just don't understand the purpose of this outside of growing the skin, because what if the bones are broken and crushed? What is the goal here?
The abdomen fat and skin got attached to his hand and created vascular links. Here, we can see the x-ray of Carlos's open and closed hands. We notice the mobility of the remaining fingers. Now the thumb, which is almost in its entirety, has reasonable movement.
Today, I can feel all fingers separately. It's a bit hard to move them because they are all joined, but I can move them one at a time. But I have faith that it will look like a normal hand in the future.
I mean, I'm sure that there's other hand specialist surgeons that could probably change at least the appearance of this hand and to make it more functional. In instances like this, by the way, you don't just also do surgery. You also work with not just a physical therapist, but an occupational therapist, because you need to make use of the hand. And occupational therapy focuses on those fine motor movements, like buttoning a shirt.
Bahia, Brazil. In 2009, a pair of healthy twin brothers were born here, Heitor and Artur. But in a 1 in 200,000 chance, they were conjoined at the waist.
So conjoined twins can happen in different parts of the body. You can be joined in the lower portion of the spine, the longer portion of the spine, the head, even the upper body. We used to use the term Siamese twins because of a case that occurred in Siam, which is now Thailand, by the way. We've moved away from that and are now calling them conjoined twins because they're literally attached. And in most cases, surgical separation is an option. This can get quite complicated in certain instances because some of these twins actually share organs or blood vessels. And if these are vital organs that you can't split or separate, that obviously becomes more problematic and the surgery becomes more dangerous.
Surgeons prefer to separate conjoined twins before their first birthday. But Artur and Heitor were too weak and didn't have enough skin to cover their wounds. For the past 5 years, the boys have endured 15 procedures intended to grow extra skin using silicone expanders. And finally, they've grown enough extra skin for the operation to proceed.
In their abdomen, they share one liver, the large and small intestines. There is only one bladder and one set of genitals.
So this is going to be tough because the liver, maybe you can separate, the intestines, maybe you could separate, but bladder, what do you do?
Heitor will have a permanent catheter, so he can urinate as well as a colostomy bag.
A catheter is going to allow for the passage of urine. The colostomy bag is going to act as the rectum and essentially store stool that you can empty.
Although the operation is over, Dr. Khalil knows that recovery is going to be a major hurdle. Heitor is alert and has been responding well, even managing small conversations with his parents. But Artur is weak and is fighting a fever.
Sadly, Artur had a very severe inflammatory syndrome. He wasn't responding well to any medication, and he passed away.
Which happens in a lot of these cases, unfortunately.
2 years have passed since Heitor and Artur were separated.
This skateboard was made by my father. Look, it's just a board, and he covered it in foam.
He looks like he's developing well in terms of his muscular structure, his verbal skills.
His recovery is surprising. He's a child that almost has a normal life. He has a physical disability, but it doesn't keep him from anything.
So he does have a normal life. Maybe a unique life, but a normal life. Click here for the most unbelievable stories from the ER, and don't forget to visit ShipStation.com/Dr. Mike to begin your 60-day free trial. As always, stay happy and healthy.